Good afternoon, everybody. All right, now I know that you're here. That's terrific. You're very welcome to this session. We're going to talk about advancing excellence and awakening the voice of Christians that are working in global health. And I really want to thank you for being here with us. The format for today is going to be this. We're each going to take a few minutes to speak. I'll introduce myself and what I'm talking about, and then each of these guys will get a few minutes to chat. I'll introduce them as well. And after that, we'll have some round-robin discussion between us. And then we're going to have a lot of time for interaction from you, the audience. So we're going to take about 20 minutes just for this, about 15 minutes for some discussion, and then the balance of time for you to fill up with your questions for the panel here. So that's the format. And I will say that I'm really blessed and fortunate to be up here on the stage with three exceptional people, Anne Peterson, Tom Davis, and Todd Nitkin. Anne is the director of the public health program at Ponce School of Medicine and Health Sciences in Puerto Rico. She's a research professor at George Washington University and began as a missionary in Kenya and Zimbabwe. She consulted for CDC and the WHO, then moved into policy and political positions, first as health commissioner for Virginia, and then as assistant administrator for the Bureau for Global Health at USAID from 2001 to 2005. In that position, she oversaw all of USAID's global health programs in maternal and child health, HIV/AIDS, family planning, neglected tropical diseases, health systems, and the launch of the Bush administration's PEPFAR program. So thank you, Anne, for being with us. Tom Davis is the Chief Program Officer for Feed the Children and formerly with the Food for the Hungry. Mr. Davis has spent 28 years in international work in planning, implementing, and evaluating maternal, newborn, and child health and social and behavioral change activities in child survival, food security, HIV/AIDS, primary health projects. He received the 2012 APHA Gordon Wyan Award for Excellence in Community-Oriented Public Health, Epidemiology, and Practice, and his work, it is a mouthful, and his work was featured in the past year in the Christian Post and Christianity Today magazines. And then Todd Nitkin here is the Senior Advisor for Monitoring and Evaluation for Medical Teams International. I'll say something else about them in a moment. And Chair of the Core Group, Monitoring and Evaluation Working Group, which is improving services for mothers and children. He has specialized expertise in the acquisition and use of data to design and implement comprehensive project plans, monitoring and evaluation plans, and health information systems. This work includes child survival and several other programs in Africa, Asia, Latin America. Dr. Nitkin has developed different types of monitoring and evaluation databases. And so that is the panel that I am privileged to share space with here and time with. It's remarkable. I'm Doug Fountain. I am Vice President for Operations at Medical Teams International based in Portland, Oregon. And thrilled to be here with you all. I thought I would just set a little bit of the context of what we're going to accomplish today as we talk about advancing excellence and awakening our voice. And I thought I would remind us of a few things that we've already heard in the conference so far. In fact, last night, Dr. Odendahl made a really key challenge to us. If you were here for that, he asked us, are we doing or providing something that is special, something that is different, something that is unique as Christians working in global health? What's different? What's special? Then in this morning's plenary session on partnerships, we heard a phrase. It came and went very quickly, but I really latched onto it. It's a big thing now in the evaluation literature called collaborative impacts. That's the idea that we share space right now where we are working towards similar goals and we can share outcomes and results with each other. So are we doing something that is unique and different, and can we identify these collaborative impacts? And I think that's a question for each of you to think about is, do you all feel that you have the information that you can prove to others that you're doing something special, unique, and different, and that you can demonstrate the impacts from that? I think some of the themes that you're going to hear from the panel today include things like differentiating doing right from doing good. I think everybody in this room has a commitment to doing good. We all really feel fundamentally that we are able to do good. The question is, are we doing right? Are we making the difference that we think we can make? Second theme is that measurement is really a part of management. If you don't measure, are we going to be able to manage effectively? And then third, as Christians working in this area, we should be able to point to stewardship, accountability, and one word that you're going to hear today, humility. I think that's a key for us. In the past couple of years, there's been a great number of resources that have come out on evaluation and research, monitoring and evaluation, that are very helpful. But one of the documents that I found really enlightening is a Gates Foundation publication on actionable measurement. And if you haven't had a chance to see it, go Google that one. They provide a framework in there, a three-part framework that talks about tracking progress, informing our strategies, and contributing to the field. The very reasons for doing work in this area is so that we can track progress, account for what we're doing, measuring inputs and activities and outputs, informing the strategies that we do, testing the assumptions. What are the assumptions? What are the achievements of what we are actually doing? And finally, are we able to share it in a way that contributes to the field? In taking the time to really reflect on that and to be able to get our methods clear and improved, we're going to be able to advance better and faster in the field, and that's what we're going to talk about today. Now, the last thing I want to say before I turn to some questions for the panel is I'm really pleased to give you a new bit of news. If you were here last year, you heard an announcement about the Christian Journal for Global Health. Now, at the time it was an idea in formation. We were hopeful, and we had a plan and a thought that we could actually pull it together. And sitting back there, Dan O'Neill and Mike Soderling are two of my colleagues. Dan is actually the managing editor for that journal. And as of 2 o'clock in the morning, on Friday morning, that baby was born. That baby was born. So the very first issue of that journal is now live at www.cjgh.org. Or if you want to get straight to the journal, journal.cjgh.org, Christian Journal for Global Health. That is a new tool for us to be able to express and to convey our voice. So I'm really excited to make a little commercial advertisement about that. So now with that in mind, let me turn back to here, and I hope I didn't 2 minutes over my time. It set the precedent for you guys to do better. Yeah, and my job is to try to corral these guys now as they talk. So let me turn first to Anne. Anne, your career spans from the highest levels of policy to health program development to research and even missionary medicine. Can you share from your experience examples of how we have moved the needle substantially in excellence, and what helps accelerate that progress?
Thank you, Doug, and thank you all. I found this very fascinating to begin to think about how do we move the needle, the striving for excellence and results, as well as what's different from a Christian perspective. So I got to go all the way back to the 80s when we were in Kenya, and those of you who have been around and in the field for a long time, you remember that time when you'd go into a community and they truly didn't believe that they could make a difference in the lives of their kids. We were all struggling with fatalism and can we do it? Will they own it? Will they move forward? I don't hear that discussion at all anymore. And the first step in getting to excellence is believing that change is possible. And we've moved the needle a long ways when we now go anywhere in the world and people know that they can make a difference, that they can make a difference in the lives of their children and their wives, in the communities around them. And that didn't used to exist. I would say the same thing happened in HIV/AIDS. I can remember teaching in Zimbabwe and going into a classroom and showing a poster of the sugar daddy with the young girl and saying to the students, "Do you know what's going on here?" "Oh yeah, we know what's going on here." Is there anything this girl can do about her risks? No, there's nothing she can do. And talking through what's possible. And I don't think that discussion would happen anymore now. Girls have been empowered to know that they can be protected, that others will protect them. There are even legal protections that didn't exist in the 80s and 90s. So the first part from my historical perspective is really believe that change is possible. Whatever the challenge is now where you're thinking, oh no, we can't do that, yes, you can. In 10 or 15 years, you'll be going, oh, of course we can do this. Now we know how. So the next sort of theme I had as I thought about it is to go the next step. If we can do it, do we actually believe that excellence is possible? Often, we do good things. We know excellence would be better. We're called biblically to perfection, right? All those verses in 1 Peter. I have to say I find the idea of getting to perfection daunting. And so the idea of striving for excellence is one that I can hold on to and begin to move forward on. And I think the keys to believing in excellence is, one, to be prayerful about your direction. Are you doing what God has called you specifically to do? And I have a life verse, John 17:4. I glorified thee on earth, having accomplished the work that thou gavest me to do. Now, it isn't just about accomplishment. I'm actually pretty good at that. The issue is, I like, as you heard in my background, I like to do everything. I just love global health. I really just want to do it all. And what happens when you do all is you don't do any of them very well necessarily. And so the key is to do the work which God gave you to do. Not all the work that's out there to do, not all of the tasks that are out there to do, but to really know who you are. And that applies to organizations as well. Who are you as an organization? What is God calling you to do? And then doing that to excellence. So one of my examples would be World Vision. I hope my World Vision colleagues will take this as a really positive. At one point, they had been doing health work for a really long time, and then they started to measure their progress in child health with their transformational development indicators. And when they got it, they thought, oh my goodness, the children are not doing as well as we had anticipated. And they had the courage and the humility to, one, acknowledge it, and to begin to restructure what they were doing. And they found that they were doing many, many good things, but the good things were not linked to accomplishing the outcomes that they wanted to accomplish with the children, and so they changed what they were doing. That takes humility to ask, to seek. It takes courage to make changes that you wouldn't otherwise make. So the courage and humility are really my third point, the willingness to do those. And I'll just finish with, I think there are a couple obstacles to excellence that are more common in a Christian world. We, in the Christian world, one of our strengths, though we don't do it perfectly, is our love for our community, for our brethren, for having a close Christian community. That sometimes hinders us from retaining the striving for excellence. I know you all can think of examples when something wasn't quite being done right, but you didn't really want to admonish the person or move them out of a place where they weren't very successful. And I've had a couple situations where it was very hard, it felt broken to highlight an issue that wasn't going well, move someone that wasn't accomplishing their purpose, and put them in another place, maybe even fire them. And at least one of the examples then, in following it up long term, both the organization and that person found their right niche, where they were in the wrong place. That was part of the being unsuccessful. And they then found the right place. So we heard today about creative tensions. I think this issue of relationships and excellence is a Christian tension. It is one of our strengths to value the relationships and to keep harmony within the body of Christ. It can also be a limiting factor for making sure we're really holding on to excellence. And I'd like to challenge us to figure out, how do we do both? Because that's what God wants from us. Thank you.
Great. Thank you very much, Anne. That's wonderful. All right, let's turn to Tom. Tom, now, during your impressive career, you've worked with organizations that just based on their names, we presume are doing great and meaningful work. If we want to advance excellence, should we not just find more food for the hungry or redouble our effort to feed the children?
Yeah. You guys, some of you know I worked for Food for the Hungry for 17 years and just recently moved over to Feed the Children. So I do find it more important now to feed the children than to provide food for the hungry, although both are really important, I think. But I think if I could choose the name of an organization I work for, it would be the Whatever It Takes Foundation. Because I really think we need to advance excellence, we need to do whatever it takes, often getting away from what we've done at the past, seeing what is working the best and not being so tied to previous things that we might have done that we felt like were working, and looking under a lot of rocks. Reading the scientific literature along with our Bibles to discover what is working the best and what is different that we probably should be trying out and testing. I think we need to do more of that. I don't think we should just be reading research in our main field of interest either, but in fields that are related. So over my career, I started out reading a lot more health and nutrition literature, for example. But some of the most important things I've learned over the years came out of the scientific literature on psychology, on social networks, biology, marketing, organizational change, and behavioral change. For example, one thing I read in the past year that when I read it, I thought everyone is going to sit up and take notice of this, was Pamela Sirkan's meta-analysis that she did for the WHO Bulletin, where they found that if we were to eliminate maternal depression, we could reduce malnutrition by 23 to 29% worldwide. Okay, so that was just amazing to me. And then we know Paul Bolton did work in Uganda showing that they reduced maternal depression 93% and had a randomized control trial to prove it in less than 3 months and at fairly low cost. So we should be standing up and taking notice of that. Another example is a set of studies that showed that wash interventions, not interventions on nutrient intake, had been more effective at reducing stunting in children. So our first thought about how do we get rid of stunting should be water, sanitation, and hygiene, not necessarily nutritional intake. So why isn't wash or depression our primary focus in reducing malnutrition? And we know that by reducing malnutrition, we can reduce a lot of child deaths. Why aren't more people testing this? Well, if we don't pay attention, I think we can stay on the wrong track for way too long and just do what we've always done and what everyone else has done with partial success when maybe there are a lot better things out there that we could be doing. And we could be devoting a lot more time to finding a better mousetrap. It always reminds me of that old joke where the guy's, he's out rooting around in his garage, right? And his friend comes over, it's at night, and says, "Oh, what are you doing?" He says, "I'm looking for my car keys." And he said, "Okay, I'll help you out." So they look around in the garage everywhere. It's been like 20 minutes. And he says, "Bill, are you sure you dropped your keys in the garage?" He said, "Oh, no, I dropped them out in the yard." And he said, "Well, why are we looking in the garage?" And he says, "Well, the light is so much better in here." And I think that's what we do sometimes. We look where the light is better, and we keep focusing there, even though we've heard that there's something else that might work a lot better. We just keep our heads down, moving in the same direction. I think paying attention to science also helps us discover the order and beauty that God has put in the universe. And it's one reason we should be keeping up with that. After reading some scientific studies, my wife will know because I'll be just grinning like a monkey. And that's kind of awe that comes over you, and that feeling that how is that possible? You know, just recently I read 1/10 of the cells in our body are human cells. 90% are bacterial cells. How is that possible? Are we more of a community at the cellular level than like this unified individual? And what does that mean in terms of how we use antibiotics? That's something they're starting to pay a lot of attention to, this idea of let's just kill all the bacteria. They're seeing some real problems with that, not just in superbugs, but in obesity, psoriasis, asthma, all of this stuff being linked to the fact that we're killing off so many bacteria that maybe we need a lot more of these than we're killing off. I don't look down on people who don't keep up with the scientific literature, but I really think they're seriously missing out on an opportunity to learn about God and God's nature and experiencing the joy that comes along with that. One of my favorite verses is Proverbs 25:2 that says, "It is the glory of God to conceal a matter. To search out a matter is the glory of kings." And I fully believe that. I think we're meant to search out the truth, and it's a treasure hunt, and it should be a group treasure hunt with each of us challenging each other along the way. In addition to looking and learning more broadly, which I've been talking about, I think we need to look more locally as well. For example, Phil Moses and I developed a more rigorous sort of positive deviance study that we've used in a lot of places now. We call the local determinants of malnutrition study. It's much more quantitative than what you'd usually use in a PD Hearth program. But it basically takes into account that there's certain people or groups with uncommon behaviors who have healthy children in communities where they still have the same challenges of not many resources and all the other problems that come in living in a community. So we need to find out what are those behaviors, those strategies that they come up with that are very successful, and pay attention to them. And when we've done that as an organization, mostly when I was working with Food for the Hungry, we found that we'd identify things that were important, like the role of sanitation in malnutrition, that years later we start hearing people saying, wait a minute, we need to pay attention to this. But we found it early because we were studying things locally. Barrier analysis is another example. This is a type of study. I developed it back in the 1990s where you compare people doing a behavior with those not doing a behavior. It's based on like the health belief model and the theory of reasoned action. And you find out the differences between the two. And we modified it after learning about AED had a similar approach. That has really helped us to understand through people's eyes locally, why are they not doing a behavior? And the first time we did this, it was shocking to me. All the community problems, all the oppression, how all these different things connected to help people to do behaviors or not that really save children's lives. So I think we need to look locally. Verbal autopsies, that's another example. Talking to parents of children who died a couple of weeks after the death, you learn some very interesting things about why exactly are children dying.
I think that's a good stopping point there.
Great.
Yeah, thank you.
Thank you.
That's great. I had full permission from these guys. Yeah, let me kill that. There we go. I had full permission from these guys to rein them in from time to time. So you tell there's a lot of passion here. Let's shift to Todd and give a few minutes there, Todd. Through the core group, you're able to influence many organizations on monitoring and evaluation activities. You set the nature and the pace for monitoring and evaluation in a variety of projects. What are some exciting developments in monitoring and evaluation that will advance excellence?
Good afternoon, everyone. It's very nice to be here. I'm the chair of the M&E Working Group at the Core Group. Is everyone familiar with the Core Group here? A lot of people are. Okay. If I'm going to give a little talk about how important monitoring and evaluation is, because it's often overlooked in projects. And what I would like to just ask you to think about is, if we really feel that we're here to do God's work and God's having us help other people, then we really, to have excellence in that field, we really need to know exactly what the people that we're serving on behalf of God truly need. And to do that, we need to use monitoring and evaluation. We need to know exactly what it is that they're having success with and what they're having challenges with. And we need to not only have quantitative surveys, but qualitative surveys to delve into not just the what, because quantitative surveys give you the what. Then you go back and you ask why. For example, in Liberia, when I was there, we found out that only 20% of mothers were bringing their child to the health facility when their child had a bad fever. So you would think, oh, they don't know what malaria is. They don't know how dangerous this is, because we automatically presume that somehow we're smarter than they are, right? Well, that's not the case at all, right? When you go back and actually speak with them, you find out and you say, why? Why do only 2 out of 10 mothers go to the health facility when their child has a fever? And they say, because my child has malaria, and I'm not going to walk 4 miles in the blazing hot sun to get to the health facility when I know they don't have anti-malarial medications. So it's a completely different answer. They know exactly what's going on in this case, and what we presumed is not actually what the case is, right? So it is extremely important to begin your project with good monitoring and evaluation, and by good I mean statistically significant. Do things in such a way that they are reproducible and that the statistics that come out of them are actually usable and are correct. And we have, you asked about resources, we have many resources that we've worked many years to produce at the core group. They're all in one place. You go to the coregroup.org and you go to the M&E Working Group site, and you will see we have knowledge, practice, and coverage household surveys, which are health surveys for mothers of children under the age of 2. We have health facility assessments, which we are working on updating. We have different methodologies, which is the way in which you actually collect the data that you can use in your organization. And I leave you with a thought, because I'm getting the flasher, that good M&E is good humility. If you really want to make a difference in this world, the best way to do it is to monitor things very carefully, to know what successes you've had and what has worked and what has not worked. And then be honest about it and tell people what has worked and what has not worked. And do it in such a way that your statistics actually mean something. And just 2 quick things about that. The first is, we were at a meeting together just recently, and in this meeting somebody had a slide up and they were saying, we did such an amazing job in this project. Look at this. Some of these, we went from 10% to 12%. And, I sat there and said, this is a shame, because we're not showing excellence here. Number one, with confidence intervals, that wasn't a statistically significant change at all. And Doug pointed out to me just earlier, even if it was a statistically significant change, is that really what we're striving for, to go from 10% to 12%, right? So let's keep all of these things in mind and do monitoring and evaluation in a serious fashion, so that when we present our information and tell people, in one of our projects we had an early childhood development component to it, and we wanted to test and see how that worked. And actually what we found out, we had a control area in our project, and we had an area that implemented early childhood development. What we found out was the area that implemented the early childhood development project actually did worse in the other health interventions. And instead of trying to hide it, we came out and talked about it, and what we realized was it was our fault. We overburdened our staff. They had so many interventions that they were doing that then when we stuck on all these other interventions for early childhood development, we actually hurt the other interventions. And only because we were honest about it and did monitoring, so we caught this at the second year, at the midterm, we were able to overcome that challenge in the next 2 years of the project. And by the end, we had a very successful project. But it's only through being honest about things and doing things correctly, so you actually know what's going on. So I leave you with good M&E is good humility. Thank you.
Wow, thank you for that from each of you. Just reflecting on all of this, many of the things that you've said could apply in a secular context as well as a Christian, but I wonder what's different among a Christian audience, and specifically, is it necessary, if we're called to do the work, if God gives us
this mandate to carry out a project, God has put it on us to implement something. Do we have to question whether it works?
I'd be happy to try and do that. In whatever 30 years in multiple countries all across the world, I've yet to meet a perfect person, perfect church, perfect NGO, or perfect faith-based organization, which means none of us are yet doing perfect work. So we don't usually know where those imperfections are, and if we don't look, we don't know. And the kind of examples that you just heard, you can't fix them, you can't make them right if you haven't gone to look. So I think that until we're in heaven, we have an obligation to look at what we have done and whether we are really being good stewards of what God's called us to do.
I would just add that I'm sure there are lots of people out there, especially in the U.S., that are really feel like their calling is helping to keep kids off of drugs. Well, there's a DARE program that's spread from state to state, been very popular for reducing drug addiction in children. But when they did a randomized control trial of that, they found that children who went through the program were more likely to use drugs rather than less likely. So I think we should cherish our callings, but always question our methods, and just have that humility of saying, maybe this doesn't not only not work that well, maybe it doesn't work, or maybe it's actually causing some other problem or hurting people more than it's helping. We should have a whole book of those at some point, just to remind ourselves that we can't just say, I'm trying to do good, so I'm sure good is happening, because that's just not the way it always works.
And what you said about there is no perfect church, no perfect organization. I always remember the adage, if you find the perfect church, don't join it because you'll ruin it. Right? And it goes for everything. And again, when you find out that something's not working, like the DARE project that he just brought up, the most important thing is they did some good evaluation and their statistics were excellent, so it showed them that something was wrong. The beauty of that is that you can then go in with qualitative research and find out why. So we thought, hey, if everyone's on DARE, there's going to be less drug use, but they found out, hey, instead, it's kind of opening up avenues where people are where kids are trying drugs. You can find out exactly why, and then you can correct that problem, and overall, you have over time actually made a much bigger difference than you would have if you weren't paying attention to these things. So once again, it shows how important good quality and honest monitoring and evaluation is.
Anything else you want to say to that? Any comments? Okay. Let me ask a different question then. Everything that I'm hearing us talk about is all very data focused, and one thing that unites the four of us here is we are all really data geeks. I can tell that. We probably really enjoy reading a journal that has statistically significant results and using that to drive our models, and maybe not everybody is like that, and that's okay. But I wonder, outside of data, how do you know something is excellent? In your experience, how do you, Anne, or you, Tom, or you, Todd, know that something is excellent?
I'll give two examples, and the first links to the last question. I've done work in the U.S. as well as internationally, and I was with the Department of Health in Georgia, and there was an outbreak in Atlanta of bloody diarrhea in African-American one-year-old babies. And CDC did their classic outbreak investigation, and they did it brilliantly, as they always do. They identified the causative organism, which was Yersinia, the causative vehicle, which were chitlins, a kind of food, and they said, okay, well, here's what we need to do. And they did an implementation. They put flyers in all of the WIC places where African-American mothers with small babies lived and worked, et cetera. And I came 5 years later and saw that every Thanksgiving, Christmas, that same outbreak was continuing to happen at exactly the same levels that it did before. So they did an excellent outbreak investigation, found out what they were supposed to, but they hadn't gone and done the why, the formative research. What was really happening? What were the cultural complexities? How was it really getting from the food that the babies didn't eat? And so it was the correct kind of an excellent work, but an incomplete excellent work. And what they really needed to do was partner with an implementing group who would go into the formative research and think through the whys and design a behaviorally, culturally appropriate intervention for that particular population. I think about, when I try and reflect on my many jobs, how do I know which ones were good and which ones were excellent? One of my examples would be, when we went to Kenya as missionaries, we expected in our community development and our community health worker training to be there at least 7 years before the local staff would be able to take it over. And they were ready at 3.5 years. I mean, to stay any longer would have hindered their leadership and their development. So for me, one of the signs of success, and I'm trying to get away from the data to a qualitative one, we could turn it over to our local staff twice as fast as we thought. And then I went back 25 years later, and it was still going without any expats, any foreign interventions, without external funding. They were continuing to make it go. So sometimes there are very qualitative measures that we just go, I know that one was excellent. It's owned, it's kept going, people care about it, and they don't keep things going if they're not really working.
Obviously, just seeing change from baseline to final that's better than what you're usually seeing is one sign. But I think in terms of a process, I look for organizations that innovate and they measure, and they continue to innovate and measure. Some of the best examples, I would say, are around the care group model. World Relief developed it. They've tested it and changed it. Project Concern International, Concern Worldwide, they said, how about if we have health workers actually from the government be the promoters in the model? Do we get as good of results? And they found it did. So we've kind of taken something and moving it forward, finding out more and more about it, but not kind of roughshod, just doing whatever, something different, but instead saying, let's keep trying to make this better and better and have a good metric at the end, like cost per life saved. If you're achieving something and lowering that cost per life saved, we know we're doing something good. And it's connected directly to that scripture in Isaiah 65:20 that said, one day no more children will die. And so we know we're going for something that God really wants.
And I would just add to that, when we're truly doing God's work and we're doing it to the best of our abilities, in other words, we found out exactly what people that we're trying to serve need, and we think of innovative and also very well tested and founded ways to do that, there are unintended consequences that occur, usually that are quite positive from that, and because God works all things to his glory. And it really has nothing to do with us. But we're called to do things in the best way that we possibly can, and we have unintended consequences. One was that same ECD project that I told you about. We were able to straighten that out after midterm, and things were going along very well. And what we noticed was that our immunization rates were also going way up, and it was because these mothers were becoming connected with not only their child, but also with other mothers and with the health facilities, and that were having immunization outreaches, and the talks were there, and they were getting their child immunized more frequently. And so that was an unintended consequence from doing things the right way. And the other thing is about innovation. Tom brought up a very good point. When you're doing things the right way, it brings you to conclusions, and when you find out why this worked and why this didn't work, it brings you to innovate and think of new ways to do things. At Medical Teams International right now, we've just changed our health facility assessment and created almost, a pretty new tool, because the other health facility assessment we had was working very well, and we said, hey, what if we added this to it, and what if we added that to it, and changed it, and now we're going to test it out, and we will be honest about how the tool works and about what we find, and we will continue to innovate, because that is what God wants us to do.
Just a quick addendum. I think both when I look at programs and organizations and even people, one of the values that I think is essential is teachability and flexibility. A lot of the things that we deal with in health, the basic health system and a body and disease, that doesn't change. So some things are static, But that's just about all that's static. All of our understandings, our tools for both diagnosing and dealing with things, are the cultures that surround it, the economics that surround, that's all changing all the time. So if you have an organization that doesn't ever change, they are likely at some point to no longer be excellent, even if they were at one point. So that idea of a continuously learning environment in an organization is going to be key to retaining excellence once you get there. And I think that's something we can look at and judge.
Over lunch, we had an interesting conversation about independent evaluation. And it links back to something we talked about once before also, about university partners or other partners coming to help us carry out evaluations. What Todd's been working on with the core group is something that is accessible by all, but at the same time, sometimes it's hard for community-based projects to really get high-quality research and evaluation done. I wonder if you could just briefly, in 1 or 2 sentences, comment on that, and then I think there's a whole audience full of questions here.
And I've gone from the implementing world to the academic world. And I mean, most of the people in this room, I think, are implementers. And implementers are really good at doing stuff. You see something going on and you just go out there and try and make a difference. What we aren't always as good at is gathering the knowledge, and that might be research or implementation research or just lesson learned, but even more so, getting the information about what we've learned out. That's dissemination, that's writing peer-reviewed journal articles, and often the doers, and I'll include myself in this, aren't as good about getting those things written because it's hard work and it's a different kind of discipline. And so academics are usually really good at that. I know people who just like to sit down and write papers. They're just waiting to hear the stories that the implementers have been working on and get it out there. I also think academia has an appropriate role in being the objective outside person to come in and do monitoring and evaluation, because it's always very hard for us to see our own failings, missed pieces, et cetera. So a partnership between implementers and academics is something that I'm really trying hard to get going these days.
Excellent. Just 1 sentence on this either.
Find a university mentor who will keep bugging you to publish, and do it with them. Just get started. They'll help you. That's what helped me.
And I was going to say the same thing. If you can link with the university, there are people there that need to get their PhD done, and to do that, they need to do these types of projects, so they'd be more than willing to link with you and do this. You're providing them, instead of looking at it as they're doing you this big favor. It's a win-win situation, so don't be afraid to call them.
Pamela's nodding her head vigorously in the front, looking for her PhD. So, yeah, that's great. Yeah, thanks for that. Now, let me turn to the audience. I know you have questions. Let me ask a question of you first. By a show of hands, how many of you, regardless of what you actually do, what your job responsibility is, how many of you in the past 90 days have actually read a published evaluation or research study, something published that you could use to either inform you or influence the work that you do? By a show of hands, past 90 days. Fantastic. Now, this new Christian Journal for Global Health, in 1 year, when I come back and ask that question again, 100% of you are going to raise your hands. I'm really excited to hear that. I would love to know a little bit of why that's the case, but I'd like to turn to you now for some questions. As you give questions, please, just 1 sentence, 2 sentences with your question, and put the question to us, and we'll do our best to handle it. But later on, after this, we can have that discussion about why those journals are helpful to you. But I was just curious about that. So any questions? And do we have a microphone runner who can help us? Microphone runner? Thank you.
Thank you for awakening the voice. My name is Dr. Elvira Barracochi. I'm president of Medigo, and I have a question about excellence and sustainability and sustaining. So what we're doing is not only moving the needle, but then moving to a higher level of assistance. So we really empower the local countries to really own what we're doing.
Well, one of the things that we're concentrating on right now is working with the district health office so that the information, if you're doing good monitoring, you can tell that everything I talk about is from the monitoring and evaluation point of view, so I'll pass it on to them after. But we're working with the DHO a lot now to try to work with them and give them data that they can use in their platform at the district so that the data we have is not just kept isolated and is actually used. Now, when it's used at the district, if it's collected properly and you come up with a good way to assess facilities and things like that, it will be used not only in the district, but then it can be scalable up to the national level. And we've done that somewhat in Liberia with the Rebuilding Basic Health Services Project, the RBHS. So that's just one example of how that can be done.
I think we need to pay attention to elegance, to coming up with solutions that are easy to communicate quickly, to which we can train people quickly, and it can be passed from person to person without us doing all the work. That leads to much more sustainable changes. I use this example a lot, but care groups start in one country. 20 years later, it's 27 organizations using in 23 countries. Part of it was very simple. It sounded so simple, a lot of people didn't believe it would work. But memes are often little pieces of information that spread very quickly just because they're small. And sometimes we have to get something down to something very simple if we want to see scale up and sustainability.
I have three thoughts. One, simplicity, make it easy. You're more likely to get there if you make it easy. So when you're moving the needle, you're doing change. When you're doing sustainability, you're trying to hold on to that change. So make it simple. I hate to say it, but I think sometimes you just need structures and maybe even bureaucracy. So I have two examples. Gates Foundation, when it started, was this incredibly wonderful, flexible organization, and you could go to them and say, "I'd like some money," and they think about it, they look at your stuff, but you never knew when to apply for a grant. You never quite knew what they wanted. You never knew when they were going to respond and tell you, and if they responded, they might change it 10 times. And so it was a wonderful source. But the working through the system was really inefficient. And as much as some of the donors are rigidly locked into bureaucracy, and that can be slow, at least you knew when the RFAs were going up and when they were due and how they were going to grade them. So we need to think about how much structure makes something efficient, sustainable, and then make it at the least amount of structure that accomplishes that still allows you to be flexible. And I go back to what Todd said earlier, the regular monitoring to make sure you're still relevant and you're still doing excellent. You don't ever get to a steady state and stop looking at yourselves.
I don't have a question. It's more of a comment about M&E. There's always people in the church who will say, well, that's just, that's too much controlling, and the Holy Spirit isn't going to be able to work through that. But if you look at the Bible, it's full of M&E, right? I mean, that's what Paul was doing with his letters to the Corinthians, and God was constantly monitoring and evaluating the nation of Israel and how they were doing with what they were called to do. So if you get people that talk like that, just say, well, that's what the Bible was all about, was monitoring and evaluation of how the church was doing. So just a comment.
That gets to an issue of I think that gets to an issue of stewardship because these are God-given resources that we have to work with, and so the opportunity that we have, stewardship, and the other side is accountability. The opportunity that we have is to demonstrate that we're using the resources that God gives us very well. And most people, I think, don't question when you put it in those terms.
And I also think this is going to sound strange coming from an M&E person, but the difference is God always knows your heart, always knows your intention, always knows what you meant, right? Sometimes when we do M&E, the mistake we make is we find out the what, that example I gave you about the mothers not bringing their children to the facility with fever. You find out the what and you make the wrong assumptions as to what's going on. So we have to be very careful to also do qualitative analysis to find out why things are the way they are, not just the what.
Nancy Harris from JSI, and I love this panel. That's advancing excellence is why I joined CCIH. But I'm wondering, sometimes we're very slow on the uptake on things which are well-proven advances. I'm thinking of the tragedy of how slow misoprostol has been available to women to save lives when they deliver at home, or chlorhexidrin for cord care, or even discarding things like alcohol before we do injections, which is proven to be useless. Can I ask the panel, how can we be faster? And you did something on depression. How can we be faster on the uptake and faster to discard practices which are either harmful or just a waste of time?
I think part of it is just speaking passionately about the need to change and the need to change quickly. One of the reasons I got involved with child survival is I heard John Rhodey speak in Haiti back in 1983 about how we could save so many lives at low cost. And later, reading James Grant's memoirs, I found out he went to Haiti, talked to John Rhodey, and came back and said, we're going to turn UNICEF around. So sometimes having that one passionate voice that says, we cannot keep doing what we're doing, here's something new, and we got to do it quickly, I think is part of it. It's not just the technical, but reminding us, jump off that track we're on. If we don't stop, we're just going to keep going on that track and say, we've got to make this move to at least test things out and get started with it faster rather than slower.
I actually feel passionately about this. When I was in Kenya, I can remember a good friend of mine from CDC had done some seminal research on enclosed drinking water vessels and how it reduced diarrhea rates because the household water didn't get contaminated. And 20 years later, I was at USAID and nobody was doing it. It was like it was a brand new thing. So I'm going to say that those knowledge leaders and advocacies organizations need to do better at the dissemination of best practices. Even what Lancet has done in the last decade has been really marvelous for going and taking our knowledge and getting it all the way out there. When I was at USAID, which does mainly implementation research, they'll do proof of principle. So zinc came out during that time and its impact on diarrhea rates. But we made a very concerted philosophical shift. We're not done with the research until we've gone all the way through to the dissemination. So you've got your basic biomedical research, that might be NIH or whatever else, your implementation research, your proof of principle. Then you need to go and test it in a place and see if it pilots and it works in the real world. Well, if it works in one part of the real world, does it work in other parts of the real world? Is it generalizable? And then you're really not even done with your research until you've learned how to take that intensive pilot situation and scale it up. If we even change our mindset that research includes all the way through the dissemination, I think we'll begin to get our successes out there much more quickly. The example I give is, Coca-Cola is everywhere. I've had Cokes in the middle of nowhere. Do they stop advertising just because we all know Coca-Cola exists? So why do we think our very, sort of niche-oriented good news about a health intervention that works or one that doesn't work, why do we think it's just automatically, magically going to spread across the world? It's going to take hard work, and we need to give as much attention to that as we do to the initial phases.
The only thing I would add to that is, in order to be a voice for the voiceless, you really need to be trusted and you need to be out there. And she already covered how important it is to continue to advocate even if people have heard it, but it's also the way you do. You need to be taken seriously and you need to have data and you need to do things correctly to show that, hey, the maternal mortality rate was here when we started, but we started providing magnesium sulfate and oxytocin and misoprostol, and this rate dropped to here, and this is a large difference. It's statistically significant, and we've proven that. And then you need to work with the DHO and work it up through the country, but you also need to advocate and stand in front of people and to be taken seriously, which a lot of the times we are not taken seriously, and it's because we have people that stand up and show they went from 10% to 12%. And that is a big part of it. So it's a bunch of different things that need to be done.
Let me do one thing that I think we're going to have one more question. But do you have something you wanted to add to that? Okay. All right. Just one more comment about that. It seems like there's almost a tension that we create, though, between the people that are doing the research and discovering things that work, and then have that passion, that fire to go change and want everybody to take up something that we know is successful. The tension is then with the communities that are working on a different pace, and the community organizations, the families that we work with, and there's a different pace of adoption of ideas and a different pace of implementing changes in their communities. Are we running into a conflict when we generate ideas of something that works, but the community has not absorbed it or taken it on board? Let me just put that as a question, then we'll have time for one more.
I'd say, I think if we have something that works a whole lot better, an example we can turn to of how fast change can happen is a cell phone. So when people are like, oh, people take a long time to change their behavior, I just don't believe it anymore. I think if it's the right change and if it fits and meets a need, people will adopt it quickly. In Mozambique, we saw 38% reduction in malnutrition, statistically significant, in 16 months. It can be done. You've got to have the research. You've got to make sure that what you do fits. But once it fits, I think it can spread quickly.
I think many of us who are in this field, especially those who are ready to get up and leave our country and go to another country, are those early adopters, those change agent kind of people. But all populations have a spectrum of people. And when you go into a community, you've got the ones who are ready to do the hard work of change, and you've got the ones that are comfortable where they are. And I think we need to use our behavior change models and remember that not when we're just talking to ourselves, where we're all change agents, when you're talking to that heterogeneous group who have different comfort levels in change, we're going to have to message to different ones. Find the early adopters, the leaders within the community, and have them bring them along, and expect it will be a little slower than you would like.
Mona, you're here. Do we have time for one more?
Sure, because mine's kind of a big question. I don't know. Well, anyway, maybe you can. This is for my M&E brothers here. But Doug, you mentioned in the beginning that as Christian health agencies, our work should be distinctive. It should show that value added. How do you envision measuring that, to compare what our agencies do with the secular, if you will, agencies? Is it possible?
It's difficult because that is a large question, but one of the ways you can do it is you carefully plot out, like for early childhood development, let me put that to you. We saw that it could affect not just early childhood development, but also other health interventions that we're doing, right? So holistic health, taking care of the whole body, spiritually as well as physically, will have the same kind of effect. That's our theory, right? So there are ways to measure that. You come up with indicators that can measure that. You set forth programs and you do the research where you have control versus intervention areas, and you show that that actually is the case. And then you find out why, right, once you get the what. So that's how you do it.
I think that the Christian organizations have some huge advantages that are going to show up in the outcomes. So we are often, the faith leaders are the leaders in their communities. They are trusted. When I think about the early research, and I haven't looked at it recently, about community health workers, lots of people volunteer because they care about their community to be community health workers, but the ones who are still doing it 10, 15, 20, 25 years later are those who are doing it because they care about the community and because God has called them to be compassionate to their neighbors. So when I think about how we are likely to be different, and when we were launching our faith-based initiative within USAID, they said, is this just going to be temporary funding under the Bush administration? I said, go and do your programs, do them to excellence, like we've been talking about, and it will have better results. It will show that you are producing the results, and then your funding will sustain. So I'm just utterly, it's a complete comfort with looking at the data. I think that if we do our work as unto God, we will be just so excellent that we'll be right in there above everybody else.
And that's a great final comment. Panelists, thank you so much for your time. Audience, thank you so much for being here.